Hey, good morning. I'm Vic Senese with UroNurse News. Be sure to like and subscribe. Today's story highlights a fascinating new study comparing two very different approaches to treating lifelong premature ejaculation. And one may provide significantly longer lasting results than the current standard medication. Hyaluronic acid injection outperforms Dapoxetine in the clinical trial. So let's take a closer look. Premature ejaculation affects millions of men worldwide and remains one of the most common male sexual disorders. Current treatment often includes Dapoxetine, an on-demand selective serotonin reuptake inhibitor, or SSRI, that can delay ejaculation. While effective for many men, Dapoxetine has several limitations. Patients must continue using the medication before sexual activity. Symptoms often return after stopping treatment, and some men experience side effects such as dizziness, nausea, headache, and dry mouth. Researchers have been searching for treatments that last longer and can avoid those systemic medication symptoms. One possibility is deep dermal hyaluronic acid injections into the glans penis. Rather than working through the brain, the injection creates a small mechanical cushion beneath the skin that reduces stimulation of the sensory nerve endings responsible for penile hypersensitivity. The goal is simple: reduce sensitivity, increase control, improve sexual satisfaction. Seems to make sense. Researchers from Cairo University conducted a randomized clinical trial involving 60 adult men with lifelong premature ejaculation that had failed behavioral therapy. 30 men received Dapoxetine 60 milligrams 3 times each week for 6 months. The remaining 30 men received a single 3 milliliter hyaluronic acid injection delivered into 12 locations within the glans penis. Investigators followed the patients for 6 months. The primary measurement was intravaginal ejaculation latency time, often called IELT. They also measured erectile function, premature ejaculation symptom scores, quality of life, patient satisfaction, and of course safety. Now, the results were impressive. Both treatments significantly improved ejaculation time compared with baseline. However, the injection group performed substantially better. At 6 months, average ejaculation latency increased to 246 seconds in the hyaluronic acid group, compared to 146 seconds for Dapoxetine. Researchers also found improvement in erectile function scores, premature ejaculation symptom scores, overall quality of life, patient satisfaction. 70% of men receiving the injection reported satisfaction after 6 months, compared with 43% using Dapoxetine. Those differences reached statistical significance. No treatment is completely free of side effects. The Dapoxetine group again experienced nausea, dizziness, headache, dry mouth. The injection group reported temporarily having injection site discomfort. Now, some men did develop bruising or small blisters, but the encouraging news, these local reactions resolved on their own within 10 to 15 days. Importantly, researchers reported no new erectile dysfunction, no permanent penile deformity, no ischemic complications, no significant numbness, no delayed orgasm. The authors concluded that deep dermal hyaluronic acid injection provides greater improvement than Dapoxetine with relatively few adverse effects. However, this remains an early study. The trial included only 60 patients, lasted 6 months, lacked the sham injection comparison group, and relied on patient-reported timing measurements. Larger, multi-center studies will be needed before this technique becomes widely adopted. Still, these findings represent an exciting potential advancement in the management of lifelong premature ejaculation. Thank you for joining me for another edition of UroNurse News. If you've enjoyed this evidence-based urology news delivered in just a few minutes, give this video a thumbs up, share it with your colleagues, subscribe so you never miss an update. Hey, tomorrow on UroNurse News, can sound waves actually attack oral cancers without harming healthy tissue? I'll explore fascinating research showing how low-frequency ultrasound may stop cancer cells from spreading, weakening their protective barriers, and potentially improve the effectiveness of chemotherapy. Join me as I explain the science behind this promising non-invasive approach and what it could mean for the future of cancer treatment. You don't want to miss this one.
UroNurse News every weekday at 9 a.m. Central Time, bringing you the news that shines. UroNurse News.